Did you know glaucoma is the third irreversible cause of blindness worldwide? Hello, I'm Dr. Anwesha, working as a consultant in Nethradhama Eye Hospital.
So, as we are celebrating the Glaucoma Awareness Week, here are your most frequently raised questions and we are here to answer them. Hello, I'm Dr. Yugandhara, working as a fellow at Nethradhama Super Speciality Eye Hospital. So, let's talk about glaucoma.
What is glaucoma? So glaucoma is a disease where, due to eye pressure fluctuation, the optic nerve can get permanently damaged and which can put your vision at risk.
So, I'll go with the next one. So, the next one says, what are the symptoms of glaucoma? So, well, in the initial and the early stages, glaucoma can be actually symptomless. So, the sides of the vision are usually affected, which progress towards the center. So, initially the central vision is spared. So, patients really don't realize that they have glaucoma. Also, in certain types of glaucoma, patients can have colored halos, they can have redness, they can have pain as well.
What are the treatment options available for glaucoma? Okay, so the treatment modalities which we have for glaucoma is in the form of drops, lasers and also surgical options according to the stage of the progression of the glaucoma. So as we know, glaucoma is a lifetime disease, so we have to put the drops for lifelong and the follow-up visits are also very important.
So there is one very commonly asked question which I come across is that these drops have to be put lifelong.
Yes,
so
correct.
Are there any side effects of these drops?
Yeah, so the most common side effect of these drops are the dry eye issue, because these drops has to be put lifelong, so the dry eye is always associated, so we have to address that too.
So the next one, can glaucoma be cured? So as we mentioned earlier, glaucoma is one of the causes of irreversible blindness, but the glaucoma progression can definitely control with early detection of the disease and treatment. Hence, we emphasize you to get your yearly eye checkups done.
Let's see what's next. What are the risk factors of glaucoma? So the first and foremost risk factor of glaucoma is family history, because glaucoma runs in family. If you have any family history of glaucoma in your parents and grandparents, you also might be at risk of developing it. So what are the other risk factors associated with glaucoma? The people who have diabetes, hypertension, sleep apnea, the person who has undergone multiple ocular surgeries due to some other reason, the person who have alcohol consumption habit, smoking habit, sleep apnea, snoring. And last but not the least, the children also can have glaucoma, which is also known as congenital glaucoma.
So let's see what is coming up next. Okay, so this looks to be a very easy question, but it's very difficult to follow. It's about the lifestyle modification for glaucoma.
Yeah, tell me about it.
So coming to first eating habits, so antioxidant rich food, vitamin A, C, E, omega-3 fatty acid rich food should be consumed, regular good sleeping habit of around 6 to 8 hours a day, regular exercising, avoidance of smoking, alcohol. And apart from this, what I feel is very important is to have a regular yearly eye checkup. That should also be included in lifestyle modification.
How frequently I should get my eyes checked for glaucoma? Okay, this is a very important question. So ideally, everybody should get their eyes checked up annually once in a year. But if you have any family history of glaucoma but there are no clinical signs, so annually once checkup is also okay. Next, if you have any little bit of clinical signs or you are at moderate risk of glaucoma, 6 monthly once is also mandatory. If you have any glaucoma, moderate risk or high risk, the clinician will let you know how frequently you should visit at hospital. So, if you have any family history of glaucoma and any risk factors associated, please book an appointment in our hospital for an eye checkup done and protect your vision from glaucoma.
Also, don't forget to share this video with someone who needs it.